Let's face it, when it comes to Medicare, there's a lot of noise out there. Friends or coworkers might be saying things like Medicare is free or long-term care is covered under Medicare. But is that actually true? Today, we want to help you make more informed decisions. We're going to play a game called Fact or Fiction Medicare Edition. We're going to be talking about what Medicare does and doesn't cover, the penalties that could cost you, what choices you actually have with Medicare, and why relying on what your friends are telling could cost you in retirement. Here to help us separate fact from fiction, Lauren Merkel, who's a certified financial planner and a certified financial fiduciary, and Anna Marie Morrow. She's the director of Medicare and long-term care at Merkel Retirement Planning. So here we are. Statement number one. It's pretty simple. Medicare is free. Is it fact or fiction?
You go first.
No, you go first.
Come on.
It's not a competition, you two.
Hey!
Fiction, which this can surprise a lot of people, Anne Marie.
It can, because what we have found as we've gone through the years and we sit down with people, of course, they typically talk to their friends, and a common phrase people hear from the older generation is, oh, I'm on Medicare, I didn't pay for that. So there is this misconception where Medicare is free. But then when we break it down, Medicare Part A is hospital insurance. And as long as you or your spouse have worked a qualified number of quarters, then you've already paid for Part A while paying your taxes. So there is no monthly premium for Part A. But Medicare Part B, everything outside the hospital, doctors, insurance, physical therapy, there is a monthly premium for that, which is also based on your income. Every year, they will do a 2-year look back to see what your modified adjusted gross income was. And based on that number could determine whether or not you pay the lowest premium or if you get moved into higher brackets. And then there's supplemental insurance, drug card insurance, parts C and D, which may or may not have a monthly premium depending on what route you go. But then you also will have copays. So saying Medicare is free, again, this is why Medicare is known as the maze of Medicare, because there are a lot of components where you may or may not have a monthly premium, but there are costs involved with it.
And that's one of the surprises we really want to negate going into retirement, because the one number that's so important to really dial in on prior to retirement is what is your monthly budget going to be? And your healthcare costs can make up a good part of that monthly budget. And a lot of people do think Medicare is free, or many people also think that Medicare will cost you less than what your group plan costs you. And in some cases, it will. But in many cases, Medicare can actually cost you more than what you were paying with your group plan. So dialing in on what your Medicare premiums are going to be prior to going to retirement can really help you narrow in on the overall budget number.
That's a common question we get all the time is, how soon should I meet with your director of Medicare and long-term care? And honestly, I think the sooner the better, because we can start having those conversations, right? We can do a cost analysis, employer group versus Medicare if you're continuing to work beyond age 65, or if there's income planning that we can do prior to age 65 to prepare for those years. There's power in that planning, which is why we love sitting next to those retirement planners.
All right, statement number two, fact or fiction. Medicare covers long-term care. Fiction, and again, something can be a fact or fiction, and we can be disappointed by it, right? People would like for Medicare to cover long-term care, but the facts are it doesn't.
When I sit down with people to go over their supplemental options, whether that's a traditional Medigap plan, which are all the letters, or if it's an Advantage plan, when I go through those summary of benefits and they see inpatient hospital stay or skilled nursing stay, 90 days. In some situations, there's 150 lifetime days. There's a lot of fine print on that. But basically, that's just 3 months of consecutive care. That is not a long time. And so people then ask, well, what happens after just 3 months? Medicare stops covering, and that is when you would need to have a plan in place for long-term care costs.
Yeah, and it's good to know that there are some facts around long-term care, and I'm quoting this off the top of my head, but I believe the average stay for a female is somewhere around 3.2 years, or the average need for long-term care, and a male is 2.2. So that 3 months is just not going to cover the average need for long-term care for most people in the United States.
And long-term care is so expensive. And so the first time we start talking to people about long-term care, it's almost like they want to close their ears because it is so expensive. Most people don't want to talk about it. Even envisioning yourself living in a long-term care situation is not fun to think about or talk about. And a lot of people don't know this, but Anna Marie Morrow is also our long-term care specialist. because we talk about Medicare so much, a lot of people may not have connected those dots, but it's such an important thing to discuss and plan for. There's also a lot of misconceptions around long-term care because people think long-term care coverage is also very expensive, and it is, but there's many other ways that you can plan for a long-term care event, and it needs to be documented and put in your plan, again, to eliminate those surprises. So if you or your loved one has a long-term care event, you can go to your plan and say, here's how you're going to pay for it, here's what you're going to do about it, and then also, here's what your retirement's going to look like for the rest of your life or your surviving spouse if one of you needs long-term care.
And that's been a really powerful conversation to have with people, because that's always been that gray cloud in the back of people's mind that they don't want to talk about it. You don't want to think that could happen to you, right? But as we've developed this conversation, it's giving people that confidence to where they don't need to worry about it because they know it's built within their plan. And should something happen to them or their loved one, they can rest assured that the lifestyle, their retirement, has that protection.
Here's our next statement. Is it fact or fiction that you can be penalized for signing up late for Medicare? Indeed, it is a fact. Okay, here with the details, our Director of Medicare and Long-Term Care, of course, Anna Marie Morrow.
This is a big part of the misconception, because when you're about to turn age 65, you know just how much mail you are getting. Even if you're still working, they know that you are turning age 65. So you're going to get a lot of paperwork telling you that you could have a penalty if you don't sign up immediately. But something of note is if you are continuing to work and you have employer coverage, it is vital to make sure that your employer coverage is considered qualified group employer coverage. And basically what that means is your employer coverage will match what Medicare would pay should you have a health event. And then employers are required to provide you notification every fall to let you know that you do have qualified coverage. Because if you don't, in fact, I just had this conversation just last week. A woman is over the age of 65 and she's on COBRA, and she wants to keep COBRA because she loves the carrier that she's with, not understanding that COBRA is actually considered non-qualified, which is confusing, right? Because COBRA is just a continuation of the employer coverage that you did have. But there's a lot of intricacies in with this, right? So make sure you have that conversation with your employer. If you are on COBRA, it is not considered qualified. And also there's drug card Part D penalties as well. And you could maintain these penalties if you incur them throughout the duration of your lifetime.
And that's why there's a lot of concern around these mailings. How many times have we had that conversation? Somebody comes in and says, I have to talk to Anna Marie. I have to talk to Anna Marie. I got this letter in the mail, and it was this big, it's almost like a big flashing warning sign. I swear, if they could send a neon sign in the mail, they would do that, just blinking. You're going to have penalties, warning, warning. But in fact, well, and it's not that bad, because it's not that bad that they do that, because you do need to be alerted. This is a decision point. You have a decision to make. Do you switch to Medicare, or can you stay on a coverage that is qualified, and which is best? And that's really where you can provide some value. Evaluate the coverage that you're on. Does that make sense to stay on, or does it make sense to switch over to Medicare?
Let's go to our next statement. Fact or fiction, Medicare covers all your health care needs. I think the key word there is all. Of course, again, we would like it to cover all of our healthcare needs, but the facts are it doesn't.
The facts are it does not. So dental, hearing aids, anything elective, basically.
Vision, right? Is vision, right?
Yeah, these are not covered, but there are some supplemental to A and B that you could enroll in that can provide coverage for those ancillary benefits. But yeah, it does not cover everything we would like to have covered.
Okay. I think we're ready for the next statement. Is there more you want to add there?
Nope.
Okay, let's do it. Next statement, fact or fiction. You have choices with Medicare. I think even I know that one. That one is fact, because I've heard you talk about it. I know you sit down with people every day and help them make these decisions, talk about some of the choices that lie ahead for those that will be electing Medicare.
Letters.
All
the letters, right? It is. Again, it's known as the maze of Medicare because of all the letters. How many letters do I need to be enrolled in? It's because there's so many options, right? You have A and B offered by the government, but then your options are supplemental plans. How do you fill in the gaps that exist within A and B, because A and B is your hospital and doctor's insurance. So you hear that and you're like, oh, I'm set. Well, parts A and B were not created to be a retiree's sole form of health insurance, right? Just like Social Security, not created to be a retiree's sole form of income. So what has happened is private carriers are now offering and have been offering supplemental insurances to fill in the gaps that exist within A and B. That's why they're actually called Medigap plans. They're filling in those holes. And then also drug coverage, right? Everyone takes different medications, and there are different drug cards available to fill the needs that you have with prescription medication. So yeah, there's nothing but options.
Not only are there a lot of options, but those options, the nuances of those options can change year over year as well. So Medicare is not just a one-time, I'm age 65, I'm eligible for Medicare election option. It's something that needs to be reevaluated and reevaluated and reevaluated each and every year. And I guess that's job security for you. That's not a bad thing. It's actually not a bad thing for you, because if you take advantage of the options that you have, you can really create a plan that works well for you. If there weren't any options and it was a one-size-fits all, there wouldn't be a Medicare job.
And it would fiddle.
And it would nothing.
There's no, yeah.
And so the options are good. Now you just have to take advantage of it.
Here is our next statement. Fact or fiction? You can change Medicare plans each year. That is indeed a fact, and it is a fact that annual open enrollment is a very busy time if you're a director of Medicare.
Annual enrollment period. Mark your calendars. Once you are on Medicare, October 15th to December 7th of every year. Think of this just like you do meeting with your tax person at the beginning of every year. This is so important, because even if your medications haven't changed, even if your needs have not changed, these plans, these drug cards, they can and typically do change the drugs that are covered. And then this is a great time also to evaluate the medical plan that you're on, whether it's a traditional Medigap plan or an Advantage plan. This is your opportunity to make any changes that you deem necessary, that fit within your lifestyle, that fit within your overall plan.
And I think it's worth mentioning that the families and individuals that we serve, we reach out to them each year. So you not only do we reach out to them with, hey, let's talk about how have any of your needs changed, then you evaluate what plan they may or may not need. And this is just such a valuable service, because you've also heard stories of people that didn't go through this process, who went to pick up a prescription drug and the coverage had changed. So therefore the price had gone from $50 to $500. I mean, it can be that daunting.
Oh yeah, and it's not even just the drug the drug not even being covered. That specific situation was the pharmacy. What's surprising to people is pharmacies can opt in, whether they're preferred in network, standard in network, or out of network with the drug card. That can also change. And yeah, that copay, we've seen it go from $15 for a 90-day supply to over $500. I mean, what a sinking feeling. This is medication people need, right? And just a devastating phone call. They didn't know what they didn't know. So putting that power in your pocket to have that preparation every year, it's a powerful tool to have.
And we said it right at the top, avoiding surprises in retirement. This preparation, this proactive preparation can help you do that. Let's talk about some more Medicare fact or fiction. Our next statement: Medicare will notify me when it's time to sign up. She laughs. You know what that means.
You're hesitating over there.
I know what this one's going to be then if she laughs.
I'll go first.
It's fiction. No, whoa, she's waffling.
I kind of want to
You want to do both?
That's okay.
Is this a word?
Explain.
Faction. So if you're on a Social Security benefit, right? If you're already receiving a Social Security benefit before you turn age 65, you'll automatically be enrolled in Medicare A and B. And I think that is a notification. Hey, you're turning 65. Here's your A and B. And there's nuances with that. If you're still working, you can deny Part B and things go into that nature. But then also, if you have not elected your Social Security benefit, I mean, you're getting all the mail, right, of penalties and things of that nature. But then also there are some people who don't know. So just being aware, being in the know of if you are still working, still do a cost analysis, right? Start maybe 4 to 6 months in advance, a year in advance. Start having that conversation of timelines, options, so that you have that confidence moving forward.
And have that conversation with a professional who understands Medicare, having that conversation with your friends and again, your coworkers, that's fun. You can have that conversation, especially because they have real life experiences, but their life doesn't necessarily mimic your life, which means your plan, your solutions won't necessarily mimic their solutions. Talk to a professional.
And that leads us into our next statement. We're talking about, of course, signing up for Medicare. So here's our last fact or fiction statement. You have to enroll in Medicare at 65, even if you're still working. It's fiction. Tell us why.
If you're still working, like I had mentioned earlier, if you're on an employer group coverage plan or your spouse is and you're on their plan, just make sure it's considered qualified by Medicare standards. And you do not have to elect A and B when you turn age 65. There's also nuances with that, of course, right? You also don't have to elect A and B at the same time. So if you are continuing to work and you've decided to not elect Medicare Part B with the premium and your supplements, you could elect Part A. It's premium free as long as you or your spouse have worked those qualified number of quarters, and it's hospital insurance. So it could come in secondary to pick up any extra copays. But again, there's nuances with that as well as far as health savings accounts, HSAs. If you're making contributions, then when you go to elect Part A, you would need to shut off those contributions. So there's all these nuances that we hear all the time. I didn't know that. And that's why there's power in having these one-on-one conversations, is to know what your options are and the best route to go, and there's no surprises.
And that's what you were talking about earlier when you said you can sit down with somebody for 15, 20 minutes and just get an understanding of what their situation is. And then you can eliminate a lot of those nuances that are not particular to your situation and talk about the things that you really care about that really will impact your healthcare Medicare plan. And that's why that sit down is so valuable. Eliminate the noise. Let's talk about what you need to talk about.
Guys, I've got a good option though for people who maybe aren't quite ready for a sit down in-person visit. It's a retire ready call. So you talk about 15 to 20 minutes. What about 15 to 20 minutes on the phone with a retirement planner? So you heard Anna Marie say several times there are nuances. What she means by that is it depends on your situation. It depends on you. You can get answers to questions that pertain to your situation by scheduling a retire ready call. There is a website on your screen right now. It's retirereadycall.com. So whether it's Medicare, whether it's retirement, whether it's what lies ahead, you can talk about it during a retire ready call. This is Retiring Today, and we thank you for watching.
If you've enjoyed this video, click here for more content. And don't forget to subscribe so that you can be connected with others just like you who are looking for entertaining retirement strategies.